Brian Thompson was a prominent figure in the healthcare industry, best known for his role as the CEO of United Healthcare, the health insurance division of United Health Group. Appointed to this leadership position in 2017, Thompson brought a wealth of experience to the table. His career was marked by his efforts to balance business success with improving healthcare access and quality. Under his leadership, United Healthcare expanded its reach and solidified its position as a leader in the healthcare space. Thompson's career in healthcare began well before he became CEO. He had held various senior positions at healthcare companies where he gained a deep understanding of the challenges faced by insurers, providers, and patients. He was known for his keen business acumen, particularly in driving growth, and his ability to forge strategic partnerships with healthcare providers and pharmaceutical companies. Thompson's leadership was instrumental in growing United Healthcare's footprint in the Medicare and Medicaid markets, which are critical to providing affordable healthcare to millions of Americans. His work also focused on expanding services for individuals with complex healthcare needs and ensuring that the company remained at the forefront of technological innovations that could improve patient outcomes. One of Thompson's key achievements was the expansion of United Healthcare's digital health initiatives. He pushed for the integration of technology into the healthcare system, seeing it as a way to not only improve operational efficiency, but also provide more personalized care for patients. This included advancements in telemedicine, digital health records, and the use of artificial intelligence to improve diagnosis and treatment outcomes. Thompson was a staunch advocate for using data to drive decisions in healthcare, believing that a more data-driven approach would lead to better health outcomes and cost savings for both insurers and patients. Thompson's leadership extended beyond financial success and operational improvements. He was passionate about making healthcare more accessible and equitable for all. His public statements often emphasized the need for reform in the healthcare system, particularly in regard to affordability. He was a strong proponent of universal access to healthcare, which he believed could be achieved through better policies and increased collaboration between public and private sector entities. His leadership in this area helped United Healthcare build strong relationships with government agencies and non-profit organizations, making him a respected figure in healthcare policy discussions. Thompson was also known for his commitment to corporate social responsibility. He believed that businesses should play an active role in the communities they serve, and United Healthcare under his leadership was involved in various philanthropic initiatives aimed at improving health outcomes, particularly in underserved communities. Whether through donations to health-related charities or programs designed to improve healthcare access, Thompson ensured that the company was not just a business but also a force for good in society. Despite his corporate success, Thompson's leadership style was marked by humility and empathy. Colleagues and employees praised him for his ability to connect with people at all levels of the organization. He was known for his open-door policy, encouraging employees to share their ideas and concerns. His leadership was also characterized by a focus on developing talent within the organization. Thompson understood that the success of United Healthcare depended on the strength of its workforce, and he made it a priority to invest in employee development and leadership training. Thompson's personal life reflected his professional values. He was a family man, deeply committed to his wife and 2 children. His family was central to his life, and he often spoke about the importance of work-life balance. His dedication to his family and his genuine interest in the well-being of others were qualities that endeared him to those who worked with him. Outside of work, he enjoyed spending time with his family and engaging in outdoor activities, which helped him recharge from the demands of his high-powered career. On the evening of December 4, 2024, tragedy struck as Brian Thompson, the CEO of United Healthcare, was shot outside a luxury hotel in Manhattan. Thompson had just stepped out of the hotel when an assailant approached him and opened fire. Eyewitnesses reported hearing multiple gunshots before seeing Thompson fall to the ground. As the chaos unfolded, the suspect quickly fled the scene on an electric bike, disappearing into the city streets. The immediate aftermath of the shooting was chaotic. Several bystanders rushed to help, but Thompson was already critically injured. Emergency responders arrived shortly after, providing life-saving medical attention before transporting him to the nearest hospital. Unfortunately, despite their efforts, Thompson succumbed to his injuries shortly after arriving at the hospital. The crime scene was quickly secured by police, and investigators began gathering evidence. Surveillance footage from nearby cameras played a crucial role in identifying the suspect. The footage showed the assailant, who was wearing a hoodie, approaching Thompson before opening fire and fleeing the scene with alarming speed. The police issued a public statement requesting any information that might lead to the identification and capture of the suspect. As news of the incident spread, many were in shock. Thompson was known for his dedication to improving healthcare and was widely respected within the industry. His sudden and violent death left a deep impact on his colleagues at United Healthcare, as well as the broader healthcare community. Within hours of the shooting, various tributes poured in from colleagues, industry leaders, and family members, all expressing their sorrow and disbelief over the tragic loss of such a visionary leader. The murder also raised significant questions about the circumstances surrounding the shooting. Reports indicated that Thompson had been the recipient of several anonymous threats in the weeks leading up to the attack. These threats were reportedly linked to disputes surrounding healthcare policy and coverage, though it remained unclear whether these threats were directly connected to his murder. Authorities were investigating potential motives, considering both personal and professional factors, but many were left questioning the reasons behind such a brazen act of violence. In the days following the shooting, police ramped up their search efforts. A reward of $10,000 was offered to anyone who could provide information leading to the arrest of the suspect. Investigators combed through nearby businesses, interviewing witnesses and reviewing additional surveillance footage from surrounding areas in hopes of identifying the perpetrator.
Actually, I was paying attention. I was holding my phone, then I hear the shot, And when I look at the guy was with a gun, like, the silent gun. I got like a black gun. And I saw him, after he shot him, he ran across the street this way. I tried to take a picture, but it's too far away.
Thompson's family, colleagues, and the United Healthcare team were left grappling with the loss. Thompson's wife spoke publicly about her devastation, describing her husband as a loving father, dedicated professional, and compassionate leader. She expressed disbelief over the loss of such a strong and influential figure in the healthcare world, adding that their family was struggling to comprehend the senseless violence that had taken him from them. In addition to the emotional toll on those close to Thompson, the murder sent shockwaves through the healthcare and business sectors. Thompson had been instrumental in shaping United Healthcare's success, and his leadership was widely regarded as a model for other CEOs in the healthcare field. His dedication to improving patient care and his tireless advocacy for affordable healthcare had earned him widespread admiration. Colleagues praised him for his strategic vision and his ability to drive meaningful change within the healthcare system. As the investigation continued, many were left wondering how such a violent act could occur in broad daylight, outside a prominent hotel in one of the busiest cities in the world. The police and investigators were working tirelessly to piece together the details of the shooting, interviewing witnesses, and reviewing available footage in the hopes of uncovering any clues that might lead to the suspect's identity. Despite the uncertainty surrounding the motive for the crime, one thing was clear: Brian Thompson's death was not only a devastating loss for his family and colleagues, but also for the healthcare industry at large. His leadership and dedication had made a significant impact on the lives of millions, and his absence left a deep void in the industry. The investigation remains ongoing, with law enforcement working tirelessly to identify the suspect and bring him to justice. The public remains hopeful that the person responsible for this senseless act of violence will be found, and that the memory of Brian Thompson's contributions to healthcare will live on, even as those who knew him continue to mourn his untimely passing. The investigation into the tragic murder of Brian Thompson, the CEO of United Healthcare, has been marked by intense scrutiny and mounting public interest. Following the shooting outside a Manhattan hotel, law enforcement immediately began searching for clues to identify the suspect. The first break came with the release of surveillance footage, which showed a suspect wearing a dark hoodie and sunglasses. The footage captured the suspect approaching Thompson just moments before the shooting and fleeing the scene on an electric bike. The suspect's face was partially obscured, but authorities believe they may be able to track down the individual using the footage, which was shared with the public in the hopes of generating leads. The New York Police Department NYPD has ramped up its efforts to find the suspect, and a $10,000 reward was announced for any information that could lead to the arrest. Investigators have been scouring nearby streets, reviewing additional surveillance footage, and interviewing potential witnesses who might have seen anything suspicious in the vicinity before or after the shooting. Police believe the shooting was a targeted attack, though the motive remains unclear, and they are considering various possibilities, including personal grievances, professional conflicts, or even retaliation related to Thompson's high-profile position in the healthcare sector. In addition to traditional investigative methods, authorities have also focused on the possibility of using facial recognition software and phone tracking to identify the suspect. The electric bike used by the shooter is also a key point of focus, as law enforcement believes it could provide additional clues about the assailant's identity or movements before and after the crime. The investigation has been further complicated by the lack of clear motives. Thompson had been the subject of threats in recent months, according to reports, particularly due to his influential role in healthcare policy. He had also been publicly vocal about controversial issues in the healthcare industry, such as Medicare reimbursement rates and the need for more affordable healthcare solutions. As a result, investigators are exploring whether the shooting was the result of a personal vendetta or if it could be linked to his professional role. With the reward in place, tips have been coming in from the public, but so far, law enforcement has not released further information regarding potential suspects or persons of interest. The NYPD has appealed to anyone with relevant information to come forward, particularly those who might have seen anything suspicious around the time of the shooting. The footage has been widely circulated on social media, and the NYPD has urged the public to come forward with any potential leads. In addition to local efforts, federal agencies, including the FBI, have joined the investigation, given the high profile of the case and the potential national implications. The shooting has drawn significant attention both in New York and beyond, particularly within the healthcare and business communities, who have expressed shock and sorrow over Thompson's death. As the investigation continues, law enforcement remains tight-lipped about the details of their progress, hoping to avoid compromising the ongoing effort to bring the killer to justice. Public pressure has been mounting, as many are demanding answers, not only about the tragic loss of Brian Thompson but also about the reasons behind his murder. With each passing day, the hope remains that the perpetrator will be identified and held accountable for this senseless act of violence. Brian Thompson's murder has sparked intense speculation regarding its possible motives, particularly due to the threats he had received in the weeks leading up to his tragic death. As the CEO of United Healthcare, Thompson was at the forefront of major debates surrounding healthcare policy, including contentious issues related to healthcare coverage, insurance rates, and reimbursement structures. These disputes, particularly those that involved his company's practices, might have made him a target for disgruntled individuals or organizations opposed to his policies. Reports indicate that Thompson had been the recipient of multiple anonymous threats. These threats were allegedly linked to his role in shaping United Healthcare's strategy, which some felt disproportionately affected specific groups, including low-income patients and healthcare providers. In particular, there were concerns about the company's refusal to cover certain treatments or its pressure on healthcare providers to adhere to strict guidelines, which some believed put profits ahead of patient care. Thompson's outspoken nature on key healthcare issues also made him a polarizing figure. He was known for advocating policies that focused on expanding access to affordable healthcare, yet his position as CEO of a major insurance company placed him at the heart of a larger debate on healthcare reform. Many individuals who disagreed with his stance on these matters might have harbored resentment or anger toward him. One of the most prominent areas of contention involved United Healthcare's decisions related to Medicare Advantage plans, which had become increasingly controversial due to their cost structure and the restrictions they imposed on patients. Critics argued that these plans, while profitable for insurers like United Healthcare, often led to reduced access to essential healthcare services for some seniors and people with disabilities. This contributed to a growing sense of distrust in the healthcare system, especially among those directly affected by the policies Thompson helped implement. In addition to these disputes over healthcare coverage, some analysts speculated that Thompson's personal life may have also played a role in the threats he received. Although there were no direct links established between his personal affairs and the shooting, the possibility of a personal vendetta or a disgruntled former associate could not be entirely ruled out. Nonetheless, the primary focus of the investigation remained on his professional role and the high-stakes decisions he made within the healthcare industry. United Healthcare's policies under Thompson's leadership had a substantial impact on millions of Americans, which made him a significant figure in national healthcare discussions. While some saw him as a champion for change and innovation in healthcare, others viewed his efforts as self-serving and detrimental to the public good. The polarization of opinions surrounding Thompson's leadership left many wondering if his death was an act of retaliation by someone who felt wronged by his business practices. As investigators continue to explore potential links between the murder and Thompson's professional life, there has been speculation about whether the threat was personal or politically motivated. The fact that Thompson had received multiple threats raises the possibility that the shooter may have been someone who was deeply angered by his role in these healthcare disputes. Whether the killer acted out of political or personal motives remains unclear, but the ongoing investigation is focused on piecing together Thompson's final days and identifying the exact cause of the violence that took his life. The investigation into Thompson's murder highlights the deep divisions within the healthcare system and the potential risks faced by high-profile executives like Thompson, who often find themselves at the center of contentious debates. Given the stakes involved in healthcare reform, the possibility that Thompson's death was tied to his role as a key player in shaping U.S. healthcare policy remains a critical avenue of investigation for law enforcement. As the investigation progresses, law enforcement agencies continue to examine the potential links between the threats Thompson received and the violence that led to his tragic death. While the public awaits answers, one thing is clear: Thompson's work in the healthcare sector undoubtedly made waves, but it also created enemies. Whether or not those enemies were involved in his murder is a question that will likely take time to answer, but the pursuit of justice for Brian Thompson continues to unfold. Following Brian Thompson's tragic death, his family expressed their profound grief and shock. His wife and children described him as a devoted family man who was deeply committed to his work in improving healthcare. His family issued statements honoring his legacy, highlighting his dedication to both his loved ones and his role at United Healthcare. Colleagues at United Healthcare also mourned the loss of a visionary leader. Many shared personal anecdotes of how Thompson had guided them throughout their careers, emphasizing his ability to make complex decisions while remaining empathetic to the needs of employees and patients. His leadership was marked by a focus on reforming the healthcare system and providing affordable care, and his passing left a palpable void within the organization. Thompson's death sent shockwaves through the healthcare sector. As one of the most prominent figures in healthcare policy, his contributions were widely respected. His leadership had shaped United Healthcare's direction, and his sudden passing left many within the company uncertain about its future. However, the board of directors quickly stepped in to assure the public that Thompson's mission would continue. They emphasized their commitment to maintaining the company's trajectory of expanding access to care and improving healthcare outcomes, principles that Thompson had championed. In the broader healthcare community, Thompson's death raised concerns about the pressures faced by executives in an industry often mired in controversy. His role in healthcare reform, particularly in advocating for patient access and affordable care, had made him a polarizing figure. While some admired his efforts, others criticized aspects of his company's practices. Nonetheless, his untimely death highlighted the personal risks associated with leading such an influential company in a highly contentious sector. Thompson's legacy, marked by his push for healthcare reform and his commitment to social responsibility, continues to inspire many within the healthcare field. His passing left a profound impact, not only on his immediate colleagues and family but on the broader industry. The conversation about healthcare reform and executive safety will undoubtedly continue, but Thompson's influence will remain a guiding force for those who continue his work. If you found this video insightful, please like, subscribe, and share it with others to spread awareness about this important story. Stay tuned for more impactful content, and thank you for watching.